My name is Javier Dieguez. I'm one of the new pulmonologists here at BSA Diagnostic Clinic. I wanted to introduce or just to discuss a few key topics, especially for the patient that presents with an abnormal X-ray or an abnormal finding on a CT scan of his chest. Usually, as we know before, women get mammograms to prevent breast cancer, colonoscopies, both men and women, to prevent colon cancer. But now it's been studied that if a patient is between the ages of 55 to 74, has been smoking for 30 years, and it has been smoking in the last 15 years, getting a film will be key because early prevention is very important in this scenario. Sadly, we are not good at correcting cancer, but if we find it in time, we're able to take it out, do surgery or do radiation, whatever it takes to control it. Now, not only pulmonologists are doing this test, usually even the primary care physicians now are involved in this as a yearly screening test. So our recommendation would be to keep up with your primary care physician or pulmonologist or other physician. Don't let go a cough without any workup. Don't let go any symptom that is unexplained without a workup. Get your test imaging study, and then once you have something on there, we will be either part of your team, or we just recommending to please go ahead and find a pulmonologist to be able to work this nodule. A nodule is something that's less than 3 centimeters. A long mass will be something that's more than 3 centimeters. So once we get to a long mass, sometimes it's too advanced. So if we can find something that's less than 3 centimeters, which is a nodule, we'll be able to follow it closely, because sometimes it might be a normal finding, might be just a benign condition, but sometimes it might be malignant. And if we can find it in time, it's very important, so the early recognition is key in this situation. There's a society called the Fleshner Society Pulmonary Nodule Guidelines, and these guidelines basically let you follow these nodules, which are less than 3 centimeters, so nodules, depending on whether you're a smoker or non-smoker. And regarding the size of the nodule, you know whether to follow the image study either in 3 months, 6 months, or if you are a smoker and you have something that's very small, such as less than 4 millimeters, you only need 1 year follow-up, and if normal, you leave it alone. But otherwise, if something is normal for close to 2 years, you feel comfortable, because cancers usually would grow. Everything else might just be benign. And sometimes when you think, okay, if we're doing screening CAT scans, you're gonna find something that was meant to be silent your whole life, but now what do we do with it? So that's why we follow closely, and if it's stable, you feel comfortable. But if it starts growing, we need to do some diagnostic procedure to find out exactly what it is. And these are the cancers that we are basically changing the outcome, because these are early stage, and when you have an early stage cancer, surgery basically is a solution, and you will not need any chemotherapy, you will not need radiation, and we just need to follow you closely after that resection to make sure that there's no recurrence. But it's very important, and I think again the key here is early detection, so we can start making a difference. Some of the questions we would get from patients would be, I have this nodule that was found on my CT scan of my chest, and my family member had cancer. Is this cancer? And definitely always it's very important to compare that film with a prior film to make sure that it is actually new or it's been there for all that time. If something's been there for more than 2 years, you feel very comfortable to give the patient the news that no, this is likely not a malignancy. But if something has been there, wasn't there on a prior film, and now you found it, depending on the smoking history, we need to do some follow-up tests to know if it's growing or not. And sometimes even the size and shape of the nodule is worrisome. A perfect circle would be a little more reassuring, that might be something benign, but a nodule that has spikes, and that's called a spiculated nodule, those are very worrisome, even whatever size they are. So it's very important just to have the peace of mind and knowing that even though you have family members with cancer, you may not have a cancer, and we can just follow it closely to give you that reassurance. Other questions that we had was that many years ago they found something on my lung and they told me that it was normal, it was benign, that it was just from exposure to some outdoor activity and exposure to bird droppings or something. And those are called granulomas. Those granulomas, basically, they look very calcified on your CAT scan. And the CAT scan, to see calcification, basically means that it's white. So if you see something on your film that is purely white, you feel very comfortable knowing that it is benign, that it was just some exposure to something in there. Usually these nodules, the way they form, when you inhale something outdoors or someplace, your body doesn't recognize it, doesn't know what it is. So what happens is it will say, you don't belong here, and start encasing itself to protect everything outside from that. And so if it's something that's been just an inhalation from some bird droppings or bat droppings or some fungal exposure, these things will start turning very calcified, very like white on that film. And that's something that we actually, when we see those, we from the beginning we say, don't worry, this is good. This is some exposure to something in your past, when you were in your Boy Scouts, Girl Scouts, when you went to do some hiking or some outdoor activities. We see this all the time. And the key again is to make sure that we follow it closely and to give that peace of mind so you don't go through your daily life thinking that you have some malignancy.